So good afternoon, and I'm very pleased to be here again with all of you, and very welcome to this session where we will try to understand better the links and relationships between the environment, human health, and data. At the heart of the field of environment and human health, there is the idea that interactions between humans and ecosystems significantly affect the well-being of both people and the environment over the time. As stated in the EU0 Pollution Action Plan, the environmental degradation can affect greatly human health, but is also a leading cause of biodiversity loss that in turn can potentially lead to a range of health challenges. The purpose of this panel is to investigate the power of big data, extracting valuable insight and partners from the massive and diverse information and integration of this information between them to better understand the complexity inherent to these dynamic systems while addressing the growing number of challenges to be faced to truly exploit this opportunity. Ethics, governance, security, responsible use of technology are just relevant examples of these challenges that need to be properly addressed to really secure the full potential of the data that we have in our hands. I'm very pleased now to introduce all our experts that will give different views also coming from different angles. And so let me start with Ducheyne, Senior Manager Material Compliance at Johnson & Johnson, Daniele, Assistant Professor at the University of Pavia, as well as Brainteaser Project Scientific Partner, José Fermoso Domínguez, Researcher for the Natural Resources and Climate Area at CARTIF Technology Center, Coordinator of the KHealthInAir project, and also member of the ECHAL cluster initiative. Now I will leave the floor to my colleague, Dimitris Georgoulis, the Innovation Project Manager at ECHAlliance as well, who will lead this first panel discussion. And then as a reminder to all the audience, as you know, you can include your questions in the chat, and we will share it with the speakers later on. Thank you very much. Dimitris, the mic is yours.
Thank you, Natalia. So, Els, thank you very much for joining us recently. The Manifesto for a European Health and Wellbeing Deal was launched by the All Policies for a Healthy Europe initiative. Can you highlight the key points and elaborate on how the European health data space can support digital healthcare? What could also be potential environmental impacts of introducing more digital health tools?
Thank you, Dimitris, for the question, and thanks for having me here at this summit. It's a very good question, and maybe I can start with the Manifesto for European Health and Wellbeing, which highlights the digital empowerment of patients. We know that the digital environment can be a catalyst in enhancing innovation at scale, but much more importantly, will help to deliver better outcomes of citizen health and well-being. So the establishment of the European health data space can bring together academia, government, and industry to address critical areas such as data security, ethics, digital and data literacy, patient participation, and AI and innovation. And so the EHDS can then therefore reap threefold value in health systems through new treatment options, more targeted treatment, leading to improved health outcomes and helping healthcare systems ultimately to get the best of their spending. But of course, with all technological innovation, we need to have acceptance, and acceptance requires that there is an adoption of a culture of data partnership built on trust. We need to be sure that data generated at one point may unlock insights elsewhere, but we also need to make sure that we understand how we can harness that data. We should base it on realistic assessments of the strengths, but also on the limitations of database solutions and how they can complement, but also enhance the work of physicians and practitioners. and how they could ultimately be embedded in both routine clinical care and breakthrough research. And I would like to illustrate this shortly with an example. Just as a challenge, you know that patients that are undergoing surgery, for example, colorectal cancer surgery, rely on the collaboration of multidisciplinary care teams. And what we see is that members often act independently from each other. We also know that surgery can cause complications and variation remains a problem, making the prediction of outcomes difficult. So one of the solutions is a platform where patients can choose to share their files with specialists in the team to improve post-surgery care, and that will accompany their recovery pathway. And through sharing their data with their physicians, they will take care of their own treatment care pathway, but also will enable the physician to take care of them by reaching out to them, exchanging notes to other people of the care pathway. So through data analytics, we can improve the quality of care and allowing both the patient and the physician to proactively take action. Now, in terms of outcome, this means we can have earlier detection, we can have a true care continuum, and greater patient empowerment. So I hope that through this example, I was able to illustrate the benefits that digital health can bring. However, at the same time, it is of the utmost importance to ensure that the environmental impact of introducing these digital technologies is being assessed. And as you may know, last year during the French presidency of the Council, ethical guidelines for digital health were published. What was remarkable is that 4 out of these 16 principles were actually linked to this environmental impact. And to that extent, since last year, a consortium of 20 partners led by myself at J&J kicked off an EU-funded project called Digital Health in a Circular Economy, which aims to develop and demonstrate novel circular and environmental sound solutions to design, collect, refurbish, reuse, and recycle digital health devices, which will ultimately lead to enabling a circular transition. And these solutions will be implemented, tested, and demonstrated in 5 healthcare ecosystems reflecting the geographical spread within Europe. And we will do so through community engaged pilots to make sure that we have that level of acceptance covered. And so through this, DICE will contribute to mitigating the globally expanding health and waste problem, covering 3 key material streams: electronics, plastics, and metals, and at the same time alleviate the shortage of critical and valuable raw materials and protecting the health and safety of those who are involved in realizing this circular economy. Dimitris, I can't hear you.
Muted, Dimitris.
Thank you very much. So, Daniele, we are happy to have you here. According to a recent fact check by the World Health Organization, e-waste is the world's fastest growing waste stream and poses a threat as a toxic material dripping into the environment. How do environmental pollution and societal factors contribute to permanent health effects? And can advances in data mashups and analytics enhance our comprehension of disease development and response to therapies?
Yes. Okay. So thank you for having me here, and thank you also for the questions actually. So the answer is not that easy. It's clear that environmental pollution contributes to the development and progression of numerous actually different diseases. And the way this happens is actually kind of complex, because there are several different kinds of pollutants that can influence our health in several different ways. And for example, regarding air pollution, which is, let's say, what I focus on basically my research projects, there are several different substances that have been demonstrated to be related to permanent effects in the progression of diseases such as asthma, type 2 diabetes, but also neurological conditions such as multiple sclerosis, also cancer, skin diseases, and a lot more. And some of them are chemical substances that they, let's say, operate interfering directly with the metabolic pathways of our body. So they basically, let's say, create some negative permanent effects in this way. Some others, for example, particulate matter, they are measurements that they are, let's say, generic measurements of pollution that indicate the presence of dust and small particles in the air. And it has been demonstrated that, let's say, their prolonged exposure in time can have an effect also in worsening the aforementioned diseases. and it's kind of for some of these diseases, actually let's say the biological way in which this happens is not really 100% clear. And it's also, this thing is even more complicated because pollution actually does not affect health alone, because it works in combination with a lot of other factors. For example, other external exposures that can be our diet, our life habits, all the kind of, let's say, external substances we are exposed to throughout our life. And also we saw in several let's say, research projects, also socioeconomic factors, because we saw that, let's say, air pollution has a different effect also in different groups of population that, let's say, are in different economic or socio-demographic conditions. So it's really, to be brief, there is an effect of, let's say, of this environmental pollution on permanent health problems in the human beings, but the way this happens is not always so easy to characterize. And fortunately, and this answers actually to the second part of your question, the recent advancements in data mining and artificial intelligence can actually help and are helping in giving us a better understanding on, let's say, how pollution impacts health. And especially they allow us to, let's say, better characterize the effects of each of these pollutants on our health, concerning the general health status and also specific diseases. And it can be useful to perform also patient stratification, prediction of outcomes, a better calculation and estimation of personal exposure to pollutants that let's say they can lead the way to create better interventions, and that can be even, I mean, either personal pharmacological interventions, but also, let's say, public health interventions. There are still some limitations, for example, mainly due to sometimes we can still see a lack of proper measurements from, let's say, concerning pollution, because we don't have usually the proper devices to do that. And of course, a limitation in the quality and quantity of data can also lead to some limitations in the quality of the results. But I believe we are we are actually moving forward in the right direction to solve these problems. Thank you.
Thank you very much, Daniele. And José, great to see you in the Digital Health Society Summit. Different life activities cause people to spend the majority of their time in different types of indoor places, such as housing, transport, workplace, and schools. Is there a correlation between indoor air pollutants and human health? And is it accurate to claim that indoor air tends to be more contaminated than outdoor air? Additionally, what is the current status in Europe regarding indoor air quality standardization and legislation?
Hi, Dimitris. Hi, all, and thank you for having me here. And definitely, yes, we spend too much time indoors. We should get out more. But anyway, yeah, there are many studies that have correlated poor indoor air quality with short, medium, even and long term health effects. And we have, as Daniele said previously, we have a lot of information about the, for example, specific impact that has particulate matter, very fine particles suspended in the air, that can cause on the human health, and that can provoke asthma or other respiratory diseases in the medium or in the long term. And furthermore, we should keep in mind, we should note that these pollutants affect or have a more significant or negative impact on children, on elderly people, and also on people who still or who already suffer other diseases, and not only respiratory ones, but also others like cardiovascular diseases or diabetes, as Daniele said previously also. So it's not, but it's a relevant or very important matter to follow up. And regarding the question about the indoor air quality and outdoor air quality, well, it's not so clear to state that all the indoors are more polluted than outdoors, but however, there are many studies that have found that some pollutants can be found indoors in a higher concentration than outdoors. For example, we will find indoors more concentration of volatile organic compounds, such as, for example, formaldehyde, that is carcinogenic and can be found at much higher concentration indoors than outdoors. Or for example, if we particle matter, again we can talk about particle matter. We can find high levels of particle matter and other carcinogenic pollutants inside, for example, in kitchens where gas is used for cooking. If their kitchen are not properly ventilated, we will find much higher levels of particle matter indoors than can be found outdoors, for example, in any of our cities. And then regarding standards or regulation, it's a difficult matter because, well, I think that we need still more research on this issue, but not only research, but also discussions to propose them. For example, we know that the most common indoor air pollutants are combustion sources in some way. For example, gas for cooking, candles, tobacco products, stove, furnaces, fireplaces, but most of them are in private spaces. So it's not so easy to regulate this issue in some way. But for example, if we are talking about, for example, building materials, furnishing or cleaning products, personal care products, or air freshener, that are could be sources of dangerous volatile organic compounds, I think that could be regulated more easily in some way, at least the composition to remove some of the compounds. So the variety of the sources of indoor contaminants is so vast that is not so easy to regulate or standardize everything. And we can make some progress, or in fact, we are researching in our project, KHealthInAir project, you know very well, but also in other projects, our sister projects participating in the ideal cluster. And we are working to identify the most polluting sources and the most dangerous pollutants in order to propose solutions to improve the indoor air quality and overall to reduce the risk of this indoor air quality on the people's health. For example, we are working on propose new ways for ventilation, new treatment solution for indoor air solution, but also we are working on what we call something like user-friendly monitoring solutions to support building managers or just users to identify when the indoor air quality is not good for health and try to address the way to ventilate or to improve the health of the indoor space. And then also we are working when it's not another solution to propose new regulation in order to avoid or to leave other potential risk for indoors. So that's my point on this.
Thank you very much, José. So we now have some time for additional questions. We have a nice question on the European data space. We talked a lot about this yesterday and today. So what would a successful European health data space mean to researchers like you? And how can we balance access to data with privacy and data safety? Maybe the question is for all of you. Maybe else could help us with this.
Yep, of course. More than happy to. So I think the promise of the EHDS is to be a marketplace of IDs in which the best can compete and can be tested. So health-related data sets can make up a universe of billions of data points, and this universe should be as accessible as possible so that researchers, scientists, and innovators can come through that space, apply data models to discover meaningful connections between those data points, test theories and assumptions. So if a new promising insight is discovered, it may spark the development of a new technology that then turns the data connection to a healthcare service. So we have to really keep that spirit of discovery alive and allow for these competing IDs to be tested and make sure that we treat innovation differently from the source data. That immediately leads me to confidentiality and data protection rules, because we really must ensure that this is being properly managed so that we can really share those data within that network of researchers and academia and governments.
Thank you, Els. Daniele or José, would you like to add anything to this?
I mean, I don't have much to add actually, so I'm not an expert on this field. To me, let's say it would be successful when. So in my experience, I usually see that sometimes there is a sort of lack of communication between the different entities, that work in this field. So academia and also private association, but even the general population. And sometimes, we work on some solutions, but we don't work on that together. And so just to add to what's been already said, in my opinion, it's really important to work also on, let's say, improving the capability to work together on this, and to improve also the communication within the experts and also with the general population, that sometimes they don't even have idea of what we're talking about.
Thank you very much. Daniele, we have another question for you. Since you mentioned that there are still limitations in the effectiveness of artificial intelligence to better understand the impact of outdoor pollution, due mainly to lack of proper measurements. So is there some possible solution to overcome these limitations?
Yes. So this is a problem that actually it's kind of typical in a lot of artificial intelligence applications. So we have really powerful algorithms with a lot of potential, but then we have to face that the data we actually use them on is not always, let's say, so as good as we would expect. And this influences also the performance of the algorithms, of course. And for example, in the, let's say, outdoor air pollution measurements, a problem that we also in the Brainteaser project, which I'm working on right now, a problem that we usually have to face is that sometimes we don't have, let's say, the proper measurements, because there are usually air quality is measured by only, let's say, a short number of air quality monitoring stations that are spread out through the territory. And sometimes it's really difficult to, let's say, measure, to have a precise measurement of pollution in, let's say, a precise location throughout a city or a country, because we don't have the hardware to do that. The solution to this, there are two possible solutions. The first one is the kind of the obvious one, so to increase the number of sensors that we can use. But this is not always easy, because real, let's say, high quality sensors are really expensive and difficult to acquire. There are some let's say, low cost sensors that can be more easy to purchase, but sometimes the quality of the measurements is not as good as the high quality one. And so we are actually working on that also in Brainteaser. We're kind of combining the high quality sensors with the low cost one, using also some portable sensors that have been developed recently that can, let's say, increase the precision with which we measure exposure to air pollution for a specific person throughout the city. Let's say, in order to improve also the reliability of these methods, of these measurements, we can actually use artificial intelligence also in this. So this is kind of the second solution. that we can use to, let's say, kind of try to solve this problem. So there are some methods that can be used to better, let's say, interpolate measurements that come from different sensors, or also estimate missing values, and let's say kind of make the data more reliable, improving the measurements that we actually have. So artificial intelligence is not only a way to improve the prediction of outcomes and the certification of patients and things like that, but it can be used also to kind of solve the problems that we have in doing, the prediction of outcomes and all the things that I just said. So I think we are also here, we are moving in the right direction, but we still need time to do it.
Thank you very much, Daniele. We have another question. So, what would formally be considered as evidence of linkage between environment and health effects, mainly from the data science aspect? And how can such evidence be advanced? Maybe we can give one example.
Okay,
For example,
is the question for me or?
No, maybe José could add an example from the KHealthInAir project.
Could you please repeat, because I lost the last part of the question? Sorry.
What would formally be considered as evidence of linkages between environment and health effects, mainly from the data science aspect, and how can such evidence be advanced?
The way we are addressing this issue in our project is try to run in parallel the monitoring of the indoor air quality in different environments, because we are studying different environments that could be important for European environment in general, but also in parallel we are running questionnaires and we are following the health of different people inside, in order to try to identify could be the health issues for these people. Anyway, we know that this is not possible to identify in the short term many of the impacts that could have these pollutants, and so we have split it. We have focused our efforts in two different approaches. For one side, we have considered the pollutants that could provoke acute effects, and especially we have recruited a group of outpatients that in fact they are high risk outpatients that we know because our doctor tell us that they will suffer some acute events during the year, maybe 6, 7, 10 times they will have to go to the hospital to be treated in some way, and our focus in this point is try to identify what are the parameters, or what are the main cause that take them to that provokes these acute events, and we want to establish a clear relationship about the exposure of these high-risk outpatients during their life, especially indoors, but also we know that they could also are exposed also to other factors. But we want to establish strong links about these acute effects and the parameters of the exposure of different parameters that they have been exposed. This is one of the approaches, but I recognize that it's not so easy to do this, and so we need to use machine learning and artificial intelligence analysis all of this information that we are gathering from these high-risk patients in order to get some results or communicable results to each other. Yeah.
Thank you very much, José.
Yes, thank you to all. I just had a something coming to my mind. I mean, we have been talking about clinical evidence and e-waste and a number of things that involve really citizens and patients, but we just mention them laterally and didn't give enough focus to this, and particularly it's also given the new regulatory framework that is coming out, how much is important really to involve citizens in the research, how much the citizen science is important in this framework, also to enhance health outcomes finally.
Yeah. Maybe I can start. So what in DICE we really chose to go for co-participation or participatory sessions and co-creation sessions with our citizen target audience. I think that's the main way of how we can include them, and also really making sure that we do it from an inclusive standpoint. So different demographic groups, age groups, and so on, just to make sure that we capture all of that.
Thank you so much. Unfortunately, time has been running really fast. We would like to thank you a lot for your participation. I'm sure that we can build upon what we have gained today in terms of knowledge and in relation to the correlation between human health and the environment. And so we will speak to each other soon. Thanks again for your participation. We close it here and we leave the floor to the summit conclusions and final remarks. Thank you very much. Have a good afternoon.
Thank you.
Good afternoon. Bye-bye.